Thank you, Mr. Davis. Now we've been through cognitive therapies, we've been through behavioral therapies, and now we're going to do cognitive behavioral therapies. Let's put those together. It's called CBT. It is super common. It is shown to be, by research, incredibly effective. CBT is really what you should be trying to do if you have most disorders. It's pretty surprising how effective it is. So the cognitive emphasis on thoughts, which Mr. Davis was talking about, changing your thoughts, with behavioral strategies that change what you do. Mr. Davis keeps referring back to that video that we watched in chapter 12 of the woman with OCD. So he asked her, okay, what is your level of discomfort? And she'd say 80, and then he'd say, now hold on to it. So he would ask her about her thoughts, and then he would have her hold it, and then he would have her touch things. So what we have to do is we have to figure out what are the distortions in thought, and what are the things that we can have you do to stop those distortions in thought. Incredibly, incredibly effective. So what it assumes is that what we tell ourselves is what causes our bad behavior. I shouldn't say bad, but maladaptive anyway. And what we want is, we want to give you tools to help you solve your own problems. We don't want to solve your problems. These are tools that even if that woman in the video starts feeling bad again, she can say, let me go back to those tools and use those. Self-efficacy, again, that's not self-esteem. Self-efficacy is the belief that I have control over the things that happen to me, that I can do things. And then we have rational emotive behavior therapy, which I didn't think was going to be on the test, but it's been on there before. And sometimes they ask for names. And here's my mnemonic for Albert Ellis. REBT, it looks like CBT, but Albert Ellis, the name I want you to think of is Hellas. Albert puts you through Hellas. It is basically CBT, but he's mean. He's not helpful. He is going to challenge you all along the way. Events don't cause our emotions. It's our perceptions and attitudes about those events that cause those problems. So what he's saying is, I'm going to pick on you, and I'm going to say that you need to change it. It's not your mean boss. It's how you respond to the mean boss. Now, I'm not saying that's true or not, but rational emotive behavior therapy was him saying, and I hope we watch the video in class, because he's kind of a grump. He just doesn't give a crap about anything, and he is going to call you on your bad thoughts. And if you don't like it, you can go see somebody else who's going to hold your hand. He is Hellas. Albert Hellas puts you through rational emotive behavior therapy. Those of you who are seniors in here and have read Hamlet, nothing is good or bad is what Hamlet says, but thinking makes it so. So it's not the bad things that happen to us, it's how we respond to the bad things. So here are the three things that Ellis says we need to stop thinking. I must do well, others must treat me well, and life must go well. He says, where were you born? Where do you think life is fair? Do you think life is always going to go well? Do you think you deserve to be treated well by everybody? Do you think that you're going to be good at everything? Get out of here. That's what Albert Ellis says. So he says, if a lot of your problems are caused by one of these three faulty thoughts. So he was very confrontational. He said, I want to expose and annihilate nonsense. Imagine what Carl Rogers would say about that. He would be the opposite of that. Carl Rogers, Mr. Sweet, unconditional positive regard, reflection of feeling for that humanistic therapy. And Ellis was like, unconditional positive regard. That's your problem. You expect people to treat you well. Maybe you need to toughen up. Really, it's pretty harsh. If you've ever watched Dr. Phil, I'm not saying that he does REBT, but it's that sort of vibe where he's just going to challenge you all the time. So Carl Rogers was centered on the client. Client-centered person therapy, that was REBT. Rogers was supportive. Ellis was confrontational, seeing the opposites. The client has the answers. Ellis has the answers. I'm going to tell you what's wrong with you. And Carl Rogers was mostly about your thinking, and Albert Ellis was cognitive and behavioral. Okay. Is psychotherapy effective? I'm going to actually back up before, and you might have already read it. Because a lot of people say psychotherapy is not good, that we should just give you a pill. that we shouldn't have you talk to a therapist. And what they found was the conclusions of many studies. And a meta-analysis basically takes a whole bunch of studies and puts them into a big pile and then analyzes them as if they were one study. And then what they found was therapy clients end up healthier than 80% of untreated people. 4 out of 5 people are going to end up healthier, measurably healthier. So I can't stress enough to you that if you are having issues, you or a family member are having issues, you really should consider the talk therapy because it gives you tools, it gives you strategies. And sometimes those pills, you got to go for years before you find the right cocktail of pills, and they have side effects and all that other stuff. I'm not against psychopharmacology, which we're going to be talking about soon. I'm not against you getting a pill if things get really bad and there's nothing else that will help you. But I really do think that this needs to make a comeback, especially CBT. It's very research based. It shows a lot of positive outcomes. And then one of the things that they think is most important is what they call the therapeutic alliance, the alliance between the patient and the client, the patient and the therapist. And sometimes it's just having somebody listen to you. It's having somebody take you seriously. It's having somebody listen to your problems, giving you some understanding, giving you some help. So talking to somebody, and now with telehealth, it has never been easier to talk to somebody. So I think it's important for you if you feel like you need some help. And I don't know anybody who couldn't benefit from therapy. Now we're going to talk a little bit about biomedical therapies. What do we have? About 6.5 minutes. Okay, we're good. We're going to talk about what we can do to help you physically. These are biological and medical. These are not talk therapies. So let's move away. So all those talk therapies, I think, are very useful. 80% of the clients are better. Then we're going to talk about the other things that we can do, and more specifically here, the drug therapy. So you've heard of big pharma, pharmacy, that's where you get your drugs. So psychopharmacology, taking drugs to treat mental disorders. Sometimes, in fact, always, I think if you are doing those, they should be in conjunction with talk therapies, because talk therapies give you, like we said, those tools for you to help yourself. They give you self-efficacy. So I think that's something that is very important for you to do. Yeah, this is kind of a crazy slide. Sorry about that. There's a lot of cool videos in here. So the first thing we have is antipsychotic drugs. These are for people who have schizophrenic symptoms, people who are undergoing psychosis. And psychosis is a complete break from reality. That means that they are hallucinating, they have delusions, they don't really understand what's happening in the world. They affect the dopamine pathways, and we're going to talk about it, especially down in this video. It can cause a lot of damage if we give them too often, if you don't have the exact right dose. They can have side effects, and here is a major side effect. It's called tardive dyskinesia. And I don't remember the tardive part as far as the etymology, but dis means bad, kin means movement. So it's going to cause a disorder in motor control, a problem with movement. And long-term use of antipsychotic drugs, when we look at this video, boy, this woman is having some severe issues that too much of these antipsychotic drugs has caused a massive side effect that is irreversible. So again, with these drugs, we need to, if somebody is on these antipsychotic drugs, they need to be under the care of a doctor, have a lot of appointments, and make sure that they have that dose exactly right. We have anti-anxiety drugs, we have benzodiazepines and barbiturates, the central nervous system depressants that end in barbitol, phenobarbital, things like that. And these should not be taken regularly. If you're on anti-anxiety medications, you shouldn't be taking them every day. You shouldn't be taking them multiple times a day. You should be taking them as needed. They're very addictive. You should not combine them with alcohol. They have a multiplier effect. It's very easy to overdose on those. So with the anti-anxiety medications, you definitely should be using them sparingly, and certainly not using them while you're drinking. And then we're going to talk about antidepressants. And this is an interesting one over here. I want to make sure you see this. So we have SSRIs, selective serotonin reuptake inhibitors, like Prozac, Paxil, all of these. And what they basically do, again, is they keep the serotonin in the synapse so that it's more likely that you will get more serotonin in your in the next neuron, and you will be happier. So these are very common. This is probably what you're going to get. If those don't work, you're going to get a tricyclic like Elavil. and they do the same thing. They inhibit reuptake. It's called a tricyclic because this is the molecule of one of these tricyclics, and it's like three circles. Tricycle, three circles. That's why they call it that. And again, which one works for which? Hard to say. We kind of it's a guessing game still to some extent. And then we have MOA inhibitors. They inhibit the reuptake of norepinephrine. We don't know if the issue with depression is epinephrine problems, norepinephrine problems. If your problems are with serotonin, we're not exactly sure which one will work. That's why medication, I think, is sort of a blunt instrument sometimes. You take it and it might not work. You take it and it might have side effects. So you just need to be very much under a doctor's care and not expect that the first time you take a pill, you're just going to feel better. That's not going to happen. You have to have patience. And then mood stabilizers for bipolar disorder. There's a song by Nirvana called Lithium. And the first line is, I'm so happy because today I found my friend. And it's called Lithium. So it's about feeling like you're not getting the high highs, you're not having the low lows. What some people say about lithium, the issue is it makes them feel really flat. I'm not sure how much we have left, but I'm at almost 11 minutes, so I'm just going to quit. Take it away, Mr. Davis.